in case anybody needs it later. So the webinar is being recorded. During today's presentation, I'm going to review a little bit of background information, including the federal and state requirements for state plans for aging. I'll share some activities that DARS has engaged in or will be engaged in as we develop the next state plan. And lastly, I'll go over what the expectations are for state agency reports that you might want to consider. So for background, there are requirements for the state plan at the federal level as well as the state level. At the federal level, the requirements stem from the Older Americans Act, and then the state law requirements are in the Code of Virginia. Those citations are listed there. In addition, there are federal regulations governing state plans for aging, and then the U.S. Administration for Community Living, which is our federal partner and oversight agency, has also provided guidance for developing state plans. Recognizing that some of you might not be very familiar today with aging services, I did just want to give a little bit of context for that. So the Older Americans Act is a federal law that was established in 1965, and it provides funding to states for aging-related services in regards to community planning, social services, research and development projects, and personnel training. This Older Americans Act law also funds area agencies on aging. In Virginia, there are 25 AAAs, or area agencies on aging. These are designated by DARS, and there is a AAA that serves every part of Virginia. Some of the AAAs are local governments, like Arlington's Agency on Aging. Others are nonprofits, like Jefferson Area Board for Aging in Charlottesville area. And then some are joint exercises of power between local governments, such as District 3 Governmental Cooperative. The Older Americans Act also established the Administration on Aging, which is now housed under the Administration for Community Living. And they serve as the federal focal point for all federal money that flows down through DARS, to DARS, and then from DARS to the AAAs. The Older Americans Act, as I said, funds AAAs, and then AAAs provide a variety of services to older adults, which are deemed age 60 and older, and in some cases, they're caregivers. These services may include care coordination, adult day healthcare, chore services, companion or personal care services in the home, home repair or weatherization, in-home or congregate meals, prepared meals for nutrition, health promotion activities, legal assistance, respite for caregivers, employment and volunteer programs, and the long-term care ombudsman program. This slide shows a breakdown of how those federal dollars are allocated, and you'll see that most of them are directed toward nutrition services, which are those home delivered and congregate meals, followed by supportive services, which are in-home services, as well as some for caregivers. The OAA establishes requirements for states, which include the development of a state plan on aging. The plan is designed to set forth goals and objectives for how the state and the state's AAAs will implement the Older Americans Act and coordinate service programs to the benefit of older adults. At the state level, in the Code of Virginia, section 51.5-135 officially designates DARS as the state unit on aging for the Older Americans Act. And as part of our agency responsibilities, we must develop that 4-year plan for aging services. Section 51.5-136 goes on to describe state requirements for the state plan for aging. So these layer onto the Older Americans Act expectations for state plans. So here I just wanted to point to a few things that we're responsible for in this section. So we are mandated to consult with the Health and Human Resource agencies, the Departments of Transportation, Rail and Public Transportation, Housing and Community Development, Corrections, and the Virginia Housing Development Authority, which is now Virginia Housing. So you can see those there. That's in addition to various other stakeholders at the local and state level, from providers to nonprofits, advocacy groups, universities, and other organizations involved with older adults and their caregivers, as well as older adults themselves. 51.5-136 goes on to identify additional components that have to be in the state plan. Here we see that we must describe the aging population in Virginia and its impact, how funding is allocated to certain programs and when additional funding is needed, information on the diversity of the aging population, information on unmet needs and waiting lists, results from any periodic needs assessments or satisfaction surveys of the AAAs, an analysis by every state agency of how the aging population impacts the agency and its services and how the agency is responding to this impact, the impact of federal and state funding on services, the status and future of Virginia's No Wrong Door initiative, and then any other factors as appropriate. So here in number 6 on your slide, you'll see that's where we are today in terms of what the state agencies are responsible for. Lastly, it just goes on to say that we must submit this plan every 4 years. In a different code section, that's in 2.2-604.1, you'll see that agencies are also tasked with identifying a staff member to be responsible for considering the agency's policies and programs as they impact older adults and individuals with disabilities. The idea, I guess, is to create policies and programs that are friendly or at least aware of those populations. DARS does not keep a repository or a list of who those folks are with each state agency. That is kind of held within each agency, but we just did want to make you aware of this code section since we're also working on the 51.5-136 regarding the state agency plans right now. So now I just want to tell you a little bit about what we're doing to fulfill the obligations to develop a new state plan. So the next state plan will be for the period October 1st, 2023 through September 30th, 2027. This aligns with the federal fiscal year. In order to have a plan in place by October 1st, DARS must formally submit our plan to the our federal oversight agency, the Administration for Community Living, or ACL, by July 1st, and then later to the governor and the General Assembly by October 1st. And that should say July 1st, 2023 and October 1st, 2023. My apologies. That being said, there are a number of other deadlines working up to the July 1st date that we have to consider. And those kind of look like this. So in late December, we sent out an email through DHRM on behalf of the Secretary Littell to state agency heads in reminding them and making them aware of the state agency report requirement. We're hosting this webinar today as an optional opportunity for some state agency staff who want to learn more. We'll be providing technical assistance. I'm happy to answer any questions you have today or through the rest of January with the hopeful deadline of January 26th for state agency reports. That then flows into February. Right now, we are in the process of drafting the plan. We're reviewing some of the needs assessment activities and findings. I'll share those with some of that with you. We're consulting with staff within DARS on their various programs to include that and collecting reports. My hope is to have a draft plan completed by February 15th, but it's probably going to be by the end of February. We'll be sharing the plan for at least 2 weeks of public comment sometime between late February and March. We will also be hosting we'll have to host a virtual public hearing on the plan to also solicit public comment. That date has not been scheduled yet. This will allow us some time in the spring to make edits to the plan and submit it for DARS's approval, and then also finalize the graphics and layout of the plan. And then also during the spring, we'll be sending pieces and parts of the plan to ACL our regional administrators who request to see drafts before we formally submit it in July. So we'll be working on that and then working through and getting the secretary's approval and the governor's office approval going into the summer. We will be putting the plan out for public comment, the federal obligation for that in the spring. But then because DARS considers this a guidance document in the summer, we'll also put it out on town hall for a 30-day public comment period. So we have a lot to do in the next 6 months. Regarding state agency input, which I know is why many of you are here today. As mentioned earlier, we're hoping that this webinar is helpful for you in thinking about what you might want to submit in your report. We're happy to answer questions as needed through the rest of the month. And then we'll be compiling the state agency reports and posting them online, and then integrating relevant pieces into the state plan draft as well. So I did want to make a note here that we actually have the plans that we solicited in 2018 and 2019 posted on our website right now. These, if your agency submitted a plan, it is posted there. If you do not see one, it means that we did not receive one in 2018 or 2019 when we did this. But you can go and check. If you have any trouble with SharePoint, please let me know. I know sometimes it's not the access sometimes gets restricted, or it's hard to download the document. So I can always send you documents via email if needed. Reviewing previous plans can be a helpful jumping off point in preparing your 2023 response. The instructions didn't change much from the 2019 reports to 2023. So you'll see that many of them, many of the information might be able to be mirrored for your 2023 report with some updated data as is relevant. Here you can just see a screenshot of the reports as they appear in SharePoint. So here's the general process that we're using for the 2023. We want to emphasize here that this is intended to be a flexible, open-ended process. You are not required to use the template that that was distributed or answer every single question that's included in that guidance. That is purely optional. We understand that states might have varied focus or needs, and so we wanted to provide that flexibility. You'll see if you look at state agency reports from last time that some state agencies answered each question, like a response for each question, and then some provided responses in more of an essay holistic format. We don't have a preference on that we wanted to be flexible to each state agency. I did also want to make a note here that since we sent the guidance out, I believe if there are any staff on the call today who are with a community college, I believe that the Virginia Community College system will be submitting one report on behalf of all of the community colleges. If you would like some more information on that, feel free to reach out to me by email and I can connect you with the VCCS contact. So as I said, this guidance mirrors what was provided in 2019 in large part. So we consider an older Virginian somebody who's age 60 or older. We understand that agency responses will vary in length and depth, and that some agencies inherently serve older adults or caregivers or are more impacted by an aging population than others. We do encourage agencies to think creatively about the role of aging in the agency's mission, programs, and services, as there may be obvious as well as not so obvious aspects of your agency's work that can relate to the aging population. Pam, yes, I will send out some additional materials after this meeting that include this presentation as well as the links. In your responses, feel free to link to any websites or supplemental information or materials or attach those to your submission. We don't want you to feel like you have to reinvent the wheel if you have something that's already relevant to your state agency. The next few slides kind of think about some of the questions that were posed in the guidance. So first, it was to briefly describe your agency's programs or services that are primarily used by older Virginians or caregivers of older Virginians. Identify if your agency has undertaken any actions to respond to the current or future impact of an aging population. Is your agency able to meet all of the service demands of older Virginians or their caregivers for the services or programs you provide? Regarding data, we invite agencies to identify the number of persons 60 and older or caregivers of persons 60 and older who have received services from the agency over the last 5 years. And then regard to future planning, here DARS is looking for any efforts that your agency has undertaken to account for the growing population, aging population. You may have heard about the talk of baby boomers or age wave. That's kind of what this question and then this scope is designed to address. So here, if you had any activities that you're planning to implement in the future to respond to older Virginians, or over the next 5 to 10 years, in what ways do you anticipate that an aging population could impact your agency? Here, this might, like, for example, if you're in a licensing field, this might mean that you see, you know, the like in health professions, that the individuals who are licensed by your board are getting older. There's an older workforce. That might be something you would note here. There could be others as well. And then the last thing, and this is the one that we really are hoping maybe to hear from state agencies about, this is recommendations and opportunities. So if you have any ideas that we should consider in responding to needs or demands, or that if you think there are potential opportunities to partner with DARS or coordinate in the future, we'd love to hear it. This plan is a state plan. It's not supposed to just be limited to DARS. So we welcome any and all opportunities to collaborate with other health and human resource agencies, as well as agencies in other secretariats and beyond, including universities. So I know that most of what I've shown you so far in terms of questions is stuff you've probably already seen in the guidance, but I did have an opportunity to kind of brainstorm some things that you might want to consider in your report. So the first obvious thing to look at is our direct services. So is your agency a provider of direct services? And if so, are any of the individuals receiving those services older adults? This could include like programs specifically, funding or financial support, educational opportunities, interventions, or screenings. Here, like kind of some of the examples that come to mind would be the long-term services and supports provided by Medicaid, the senior alert for missing older adults, any state-operated geriatric hospitals or veterans care centers, the senior farmers market program, or any specific aging-related housing assistance are some things that might be fall under that umbrella. State agencies may also want to consider the internal impacts of aging. So what does that mean for your staffing demographics within your agency? Are agency employees also serving as caregivers for family and friends? Have you noticed that? Are there workforce shortages or needs? And has your agency started to look at, is there a need for, and if so, have you started to work on succession planning for your agency if you have a lot of individuals who are nearing retirement? Agencies may want to look at partnerships with other agencies or entities that could really, provide interdisciplinary or broader sweeping initiatives. These could be often identified by examining advisory groups or work groups that your agency might be serving on, or sometimes they can be through large grant opportunities through federal government that involve multiple state agencies. Given the increasing use of technology in all areas, especially as we come out of the pandemic, there might be some impacts related to accessibility and technology. So does your agency provide materials that are large print or accessible for individuals with disabilities who have low vision or hearing loss? Also, is your agency's website compliant with the Americans with Disability Act, and which is the 508 website accessibility? Regarding constituency services, here you might think about if your agency has received significant contacts or inquiries from older adults or caregivers, or who may be doing outreach on behalf of older adults or caregivers. For grants and contracts, this could be grants or contracts that your agency receives and then implements, or it could be those that you provide, where you're the funder and you're funding projects under your agency. And do those have any impacts on older adults or caregivers? And then lastly, kind of to think about is, does your agency offer specific programming? This could be educational events, expos or fairs, participate in training programs that serve older adults or caregivers, or professionals or paraprofessionals. So here I'm thinking about if your agency perhaps ever exhibits at a senior fair, or how some of the housing agencies do that, I believe. So that might be an opportunity where you could highlight that as well. Regarding, we know that agencies are very varied in terms of how they operate. So I did want to note that we have thought a little bit about potential opportunities to highlight for universities or institutions of higher education. And that could include adult education, or like the ability to audit. Sometimes that is offered for older adults. Tuition waivers or discounts, lifelong learning services or institutes. Some of the universities in Virginia operate lifelong learning institutes, and that's a really wonderful service provided. Also, if your university has a center or an institute, for example, the Virginia Center on Aging at VCU, and then any degrees or concentrations. So if you offer degrees in gerontology or geriatric social work, or concentrations in that field would be helpful. And then for agencies that function more like museums or attractions, it might be interesting to consider visitors and look at the demographics of individuals who visit your museum or attraction, or have a membership. If your agency provides a discount, like a senior discount, if you offer special programming for older adults, and then also potentially if you have older adults serving as volunteers with your museum or attraction. These are just some examples of things designed to help state agency staff consider what they might want to put in their analysis that they submit. Again, none of these are specifically required to be addressed in your report. These are just intended to be helpful ideas. To provide some additional thoughts on this, I wanted to spend a few minutes just talking about what we've done regarding a needs assessment for the state plan. To meet the state plan deadline, we've already engaged in some activities, but we'll continue to be doing more as we move into the spring. So this fall and winter, DARS partnered with a few entities on the needs assessment. So first, DARS contracted with a company called Polco, which offers the community assessment survey for older adults, which was a mailed survey and an online survey for older Virginians age 60 and up. In addition, we also partnered with the Virginia Center on Aging at VCU. Their VCOA staff conducted listening sessions with stakeholders and older adults. And they also looked at recent data and trends on the conditions and characteristics of older Virginians. At this stage, we're conducting some outreach to state agencies to get input on the state plan. And then I'm also, as I mentioned, meeting internally with our program staff at DARS to get their input on the plan. We've been working closely with the 25 area agencies on aging, and we will be engaging with other stakeholders as we issue the draft plan for public comment. Regarding the survey that we conducted this fall, wanted to share with you that the CASOA is a benchmarking survey that's been used in other states and local governments, Colorado, Indiana, and Montana most recently. The CASOA allowed us to be able to hear and solicit data or input from older adults directly. And these were older adults that were not necessarily adults with whom our agency or the AAAs have served or interacted with so far. So they were community dwelling older adults. And The design of the survey allowed for the sample to be a representative, validated, and reliable sample spanning the entire Commonwealth. So in the survey process, there was 2 steps. First, they did a mail survey that sent postcards and mailed out versions of the survey across Virginia to a representative sample based on population across the counties and cities in Virginia. And then the second was an open sample web link that we distributed through a press release and through our partners in a toolkit to try to encourage distribution to older adults. At the end of the survey, we ended up with almost 9,000 completed surveys, which is an overall response rate of 10% and a margin of error of plus or minus 1 percentage point. The results have been weighted to reflect the proper demographic composition of each AAA service area, as well as the state. At this time, we are still in the process of compiling the final report materials, but I'm hoping to have those posted on the DARS website in the next week or 2. In addition, as I mentioned, the Virginia Center on Aging at VCU also conducted some listening sessions with that consisted of individual interviews, focus groups, and 2 written interviews. These were semi-structured interviews. One was for providers and professionals, and then one was for older adults or caregivers. They held 2 in-person sessions in rural areas to accommodate potential concern for broadband for electronic listening sessions. They allowed for a couple of written responses, and then one of the sessions was held in Spanish and one was held in Korean. The overarching theme of those needs assessment identified 12 themes focusing on abuse in later life, stereotypes of aging, aging in place as a priority, the need for caregiver supports, and education and awareness at all levels about aging, financial and income related concerns, healthcare and housing concerns, the need for increased accessibility, challenges with legal assistance and end of life, those types of things. Overall frustrations with systemic and organizational barriers, and the need for increased workforce retention and expansion. That report has been completed, and I'm working with my web team to hopefully get that report as well as some of the other materials uploaded on our website soon. In developing our state plan, DARS is really trying to tie some of our priorities to our MMR and our OKRs with the Secretariat. And so we are really interested in how we can continue to provide increasing ability to serve older adults and individuals with disabilities who want to live independently while also protecting those vulnerable adults. In addition, we hope to foster innovation in aging programs and reduce food insecurity by increasing the number of older adults and individuals with disabilities who are accessing food programs, which could include the DARS, our Area Agency on Aging home delivered meals, or SNAP benefits. So we are hopeful that some of the needs assessment activities will be posted on the website soon. Apologize that they're not there for you to potentially peruse as you developed your state report, but you may have also had some of your own needs assessment related reports or information that you can glean from that may relate. That concludes the summary of my written and prepared remarks, but I did want to allow time in case anybody had any questions that they wanted to ask, or if you wanted to chat or pick my brain, I'm happy to do that. And I think you can raise your hand or you can put something in the Q&A. And then I'll hang out here for a little bit longer, give you guys a few minutes, but if, like I said, that concludes my sort of summary and my prepared remarks, but I'm happy to answer questions. Okay, we do have a question in the chat about the length that we're looking for. Catherine, the length varies for each agency, depending on how much of a potential focus or population interaction they have with older adults. So some are short, like 1 page, and some are longer and can be up to like 20 pages, I think. So if you peruse some of the ones on the website, you can kind of get a good idea of what might be a good fit for the type of agency that you have. Where do you find the previous reports from agencies? Let me see if I put it in the Q&A, if it'll. Oh. Okay, so I think maybe if you have the Q&A open, we had one question about where to find the previous reports, and I've dropped that link in the Q&A. I will follow up with everybody who registered for today's webinar. And after the webinar, and I'll send out the copy of the slides as well as the link to the current state plan and the 2019 state agency reports. On the web page is a link to a SharePoint. If you have any trouble accessing that SharePoint, though, please let me know and I can send you some reports. I know sometimes the permissions get a little finicky. Let's see. Okay, when it says Christy, yeah. So what I can do, if you would just send me an email with your agency, what I can do is I can pull some other agency reports or your former agency report if you'd like and send them to you directly. I don't have a good workaround for the SharePoint situation that sometimes people encounter. We have a question that some of our grant programs don't collect age data about recipients. How should we address that? I think you could note that, like just say, we have these grant programs that likely serve older adults, but we do not collect the data on the specific number of older adults served or something like that. You can kind of indicate if you have anecdotal understanding of older adults being served, but you don't have the specific data, it's okay. Lynette, if you send me an email, I'll put my email in the chat for the Q&A for you. If you do not see your state agency report on the 2019 SharePoint, then we did not receive one in 2019. I did not compile the state agency reports for the plan from 2015, but I do have access to a folder that looks like it has potentially, I don't know if it's the complete folder of all the agency reports that were received in 2015. But if you send me an email, I can maybe see if there's one in 2015. I will say in 2015, the guidance and the instructions was a little bit different, but it might still be informative to you. Or like I said, if you might help if you look at like a peer agency, that sometimes is helpful if there wasn't one for your agency from 2019. Just checking. I don't think I'm missing any questions right now. Answering most of them live, I guess. All right. I'm not seeing a whole lot of any other questions that have come into the chat or the Q&A, I mean, but you should have my email. If you have any questions, please don't hesitate to reach out and talk. I'm happy to provide some advice or input. This is not intended to be, hopefully it's not too burdensome. It's not intended to be any sort of gotcha or anything. It's just really supposed to help everybody fulfill the obligations that are in the code. And we'd love any opportunity in the state plan for aging as we're working on it. Like I said, we have to develop strategies goals, objectives, and strategies. So if there's opportunities for us to partner with your agency, please reach out. We'd love to hear about those and maybe see if we can weave that into our state plan for the next 4 years. So with that, I'll say thank you, and I hope you all have a good rest of the afternoon.